All right, good evening, everyone. Those that are local in Utah, national and international. Black Physicians of Utah is having its first Instagram Live event, and we will be discussing patient empowerment, and particularly patient advocacy and its relation to implicit bias. Next, we will have several physicians and a PA here join us for this discussion, and Darren Young. Further introductions will go with Dr. Erica Biden.
Okay, I'm not the president. Good evening, everyone. Thank you so much for joining us. We are so grateful to have your attention and your ears and hope that this reaches as many people as possible. This panel was purposely curated with a group of providers as well as a patient advocate to help empower you and your family as you navigate the healthcare system in spite of implicit bias, and we'll talk more about that. I just want to introduce this distinguished panel. First, I'd like to introduce you to Dr. Richard Ferguson. He is an MD and an MBA. He's also the president and founder of Black Physicians of Utah. Over here to my left is Christy Ma. She is a physician assistant in the Division of Pulmonary Hypertension, Cardiology at the University of Utah. We also have Dr. Safu Pradhan. She is a family medicine physician at Intermountain Healthcare. My name is Dr. Erica Baden. I'm a family medicine physician at Granger Medical. Our physician panel, our provider panel, our patient advocate panel is also diverse not only in our cultural and ethnic backgrounds, but also in our type of practice. So you have people who are patient advocates, you have providers who are in private practice, academic practice, as well as in managed care. And even in all those facets and divisions of medicine, there's still implicit biases as well as discrepancies when it comes to healthcare delivery and access in people of color.
Well, thank you for that great introduction, Dr. Baden. So to start us off on understanding and Darian Young. So sorry that we didn't get a chance to you. So Darian, would you care to, so Darian Young is an Army veteran and also a peer support advocate at Salt Lake City VA Medical Center. Darian, any choice intro words of anything I left out?
Thank you very much, Dr. Ferguson, for inviting me, and I'm excited to be here to share any helpful thoughts and from my perspective that could add to the importance of what this is. I am a veteran, served in the Marine Corps, served in Iraq, Afghanistan, several occasions, was injured, and came to Utah to work with this VA here to get my injury seen and taken care of, which is out of my element. I'm from the South. I'm so glad to be here in Utah, and I think I can bring some good word to this panel.
All right, thank you,
Thanks
Darren.
again.
Thank you, Darren. So to start us off, just so we have a little bit of foundation for the discussion, we're going to go over some definitions. And I think we should start with implicit bias. It's often been stated in medicine. It's also prominent in business. It's seen quite a bit in public health, but it's a big factor when it comes to people often making decisions. Dr. Baden, would you care to define implicit bias?
It's a tough thing to define, but it's very tangible, especially if you've ever been in the healthcare system as a person of color or as a woman or as somebody who is of a diverse gender and diverse sexuality. Implicit bias, often the person who is delivering the bias is unknowing of their implicit bias. It's an unconscious bias that they have, but it's very palpable on the receiving end of the other person. Implicit attitudes are, again, like those thoughts, those feelings that are not really brought to the conscious mind, but they are definitely affecting the way that healthcare is delivered and how healthcare is accessed and also influences outcomes for people, for a certain group of people.
I mean, sometimes the bias could just be, especially when we see bias testing, just colors that are preferred. And that can be subconscious, especially when people are just trying to say, all right, do you like it or do you not like it? And sometimes people will just, between two colors, between white and black, and often what sometimes an attribution that would be associated with that color. And so some people, angelic, heavenly, they sometimes think white, purity, black often doesn't have that connotation. All right, so patient empowerment. Christy, would you like to explain that for us?
So patient empowerment is just what we are, as healthcare providers, want to see more of in healthcare itself. We can spend, sometimes 15 minutes, sometimes an hour with patients, but that's only 1 hour out of, unlimited hours, and you only can control so much, and we want to allow our patients to have control of their care and understand why we're doing certain things and kind of the ins and outs of and the goals of our treatment. Sorry, I'm trying to give kind of an example here if you want to. So
No problem. Part of this is when you go to a provider, physician, an ER visit, you may be given a medication. And we want to make sure that if you're given a treatment, you understand why you were given that treatment and what the purpose of that treatment is. You want to also be empowered to say, no, that is not the appropriate treatment for me. That's something that we want to advocate, that you understand. We also want to make sure that you are listened to and heard. That's another way that we want you to feel empowered when you are navigating the healthcare system. We also want to make sure that you feel that you have the safety and liberty to ask questions without fear and without being rushed.
Thank you, Dr. Baden and Christy. Now, our last definition before we go into specific points under patient empowerment and implicit bias, patient advocacy. Dr. Pradhan, would you care to explain what is meant by patient advocacy?
So whereas patient empowerment refers to a patient's ability to stand up for themselves, ask the questions that they have, make sure they're understood and they understand the information they've been given. Advocacy comes from our side, the provider side, where we try to do what is in the best interest of the patient. And that's not necessarily for us to define. It is individual based on the patient and their background, their beliefs, and their priorities. So often we try to be advocates, but due to our implicit biases, we're not able to do that in a meaningful way. So that's where patient empowerment comes in, where you tell us what's important to you. What do you understand and not understand? Where would you like your care to go? And then we can better advocate for you. So.
Thank you. So to start off with that, how can, what's an example of patient empowerment that is shown that without it or encouraging it, how a healthcare outcome is affected? Does anyone have a recent or historical example with patient experience? Dr. Baden?
Thank you. I recently had a patient who I hadn't seen in 2 years, but was seen by 2 other providers for the same concern. It was abdominal pain. Through a series of follow-ups, his pain persisted, and eventually he empowered himself to listen to his body and sought treatment elsewhere in an emergency department. The emergency department clinician there did a study which showed that he had a pancreatic mass which was cancerous. So had he just listened to what the other providers were telling him that his pain really was, he would not have known about this diagnosis and he could have had a worse prognosis. But he listened to his body. He felt empowered that he didn't have to take that answer because he had his intuition and knew that something else was going on. He sought appropriate care elsewhere and had a diagnosis that was conclusive and definitive, and caught early enough that his outcome is fortunately going to be much better than had he just waited.
Thank you. And Darian, do you have an example of where you feel an outcome of a patient or even your own experience would have been changed if you or someone that you were part of your peer support were able to be empowered?
All of us can be empowered, not demanding, but empowered to be a part of the team in our care. Yes, there is explicit bias in the culture of the United States. Although it seems very sad to say, it is what happened. Although many may define that differently, these things did happen for all of us, and for those who have the opportunity to afford or have the access to medical care, like my own self, have implicit bias. I live in Florida, and once I was diagnosed with kidney failure as my main injury from serving in the Marine Corps in Iraq, and had it not been for being a veteran, I would have not had the finances enough to get access to healthcare, get access to medicine, get access to a new kidney, and have a successful kidney transplant going on 7 years now. Getting that at the Salt Lake City VA, having to relocate from the South to what was deemed a better opportunity place, to come out here to Utah, which doesn't have any issue with diversity. It just lacks a lot of diversity here in Utah, but getting the right care.
So, Darian, thank you for sharing that. Do you feel that your empowerment came from within yourself and your Marine Corps background, or did you have assistance or a leader or someone that looked out for you along the way?
Really both. I appreciate the question. Just really, taught in the Marine Corps, in the military, of a more structured life. But knowing the seriousness of our injuries and the history for veterans in getting good access to care, my empowerment, had to rise because of what I was explained of what's going on health-wise, and that's why I'm so passionate with working with veterans to be more empowered. Again, not demanding, but people are empowered to be included in their care and everything of what the doctors, what Christy shared is just so true. It should reach out to everyone in the country, not just veterans, the persons that serve here, but to everyone that who has health, everyone who should care, not just the institutional explicit bias traditions that are going out in the United States.
Okay, thank you, Darian. So, Dr. Pradhan, could you give an example, possibly from your experience, where you might not have realized that you weren't being the best advocate for your patient, as based on just reflection or on feedback or follow-up with the patient?
I have had a patient who came to me with some back pain and gave me the story of, just kind of playing with her grandchild on the carpet. And she just hurt her back, and, she's been going to work every day, 8 hours a day, but the pain hurts and it's, making it uncomfortable for her to go up and down stairs. And she's come to me 2 weeks after this injury, and I did an exam, we did all of the maneuvers, and she told me, what hurts. And it seemed to me like a simple muscle strain, especially because of the demeanor that she took. And she came back to me the following week and said, okay, now there's shooting pain that's going down my leg. And I'm still going to work 8 hours a day. So then I realized that she probably had a herniated disc and was very stoic and had to go to work and felt it was important to go to work. And where I had taken that as her pain is not that severe, for her, she was working despite the severe pain. And I'm grateful that she came back so we could order the proper imaging and get her treated appropriately. And I'm glad that, we had the relationship that she felt comfortable doing that. Anyway, so I'm grateful for that experience and, opportunity.
Can I share something?
Yeah, I was going to say, Christy, do you have an example of a delay in care and might have related as a result of the patient not being as well informed?
Yeah, actually it's more on a personal side, actually, with my own father. I think navigating the healthcare system has always been really difficult for a family, and as children of immigrants, we've been used as translators, as, tax accountants and all that good stuff as we grow up, but we're relied on to translate a lot of these things so it's understandable. But my dad, at the beginning of the year, had a work accident, and I was out of town, and my brother was as well, and he's like, oh, I just hurt my leg a little bit. And he actually hurt himself when we were still in town. We were waiting to board the flight. Didn't find this out till later, but he stayed at work because felt that he needed to. He's like, the pain was there, but he was able to stay and finish out his shift. He works graveyards. And then we came back, and they sent us to, an occupational med clinic, and I went just like I used to when I was a kid, just so that way I knew my dad would, my dad typically just kind of nods and just doesn't ask questions, the opposite of what we're trying to teach today. And I sat there and I just kind of sat back and just watched the provider, look at him. I helped translate kind of the history and what had happened. He was getting up on a machine to unjam it, planted his foot, twisted, heard a pop. And so in my head, that's ACL, right? But he's not a very active guy, and I'm like, that's kind of weird, and he didn't have a lot of swelling, and so I was like, we'll just check. And I had checked him at home just to get an idea, but we had to go through the right channels in order for this to be covered by workman's comp. Well, we went there, and it was one of those things where, like, our providers are sometimes really rushed, and because he didn't complain about a lot of pain at all, he did a couple maneuvers, and then he checked his, MCL and did just kind of collateral ligaments and didn't do an ACL check. And I didn't want to say that I was a provider until he concluded and was like, oh, okay, it's just a sprain, we just got to get you back to work and quote, not screw it up for the day shift, is what he said. And I was very upset. But I advocated for my dad because I knew that there was something missing, and I asked him to do it. And I asked him to kind of go through the ACL testing and whatnot. And my dad, doesn't show a lot of pain, like it takes a lot. And he did one test, and my dad, that was the first time that I've ever seen my dad he grabbed him because the maneuver hurt so bad. And I was like, well, that's a positive test, and so he was then I did say that, I did look at him, and he finally figured out that I was a PA, and
Sorry to interrupt,
No, go
but
ahead.
what do you think our viewers here could understand if they're not in the medical field on how they can advocate for their loved one?
If something doesn't feel right, or if it doesn't feel thorough enough, be upfront and honest. I mean, we were lucky enough to have a very supportive, his company, the nurse there was very supportive. They kind of knew, they had a history with this place and kind of knew that it wasn't going to be very thorough, but they had to go through it because of like business things. So I asked for a second opinion, and I asked for the provider to write that, to get that done.
And just to highlight that, it is your right to seek a second opinion. You are allowed to, you don't have to ask. It is your right, you have that entitlement.
And I wanted to give an example, if that's okay. Just you don't technically even have to physically be present when trying to advocate for a loved one. And it doesn't always have to be a family member, it can just be a trusted friend. It's often very anxiety provoking to be in a doctor's office, especially dealing just with the unknown. And then sometimes you don't understand what is being explained to you. So you're really kind of caught in a bit of a haze as the patient when you're, especially if it's not good news. And so you're scared, you're frightened, and so you may be unable to really receive instructions, and then you leave with more questions than you were able to get answered while there. Having someone there can actually, they are on the outside, and they can look at your facial expression, look at your nonverbal cues, and then try to ask the provider, please explain a little bit more. My mother, my cousin, my dad, my grandma, my grandfather, can you explain it to me so I can explain it to them? And then also, when I said you don't physically need to be present, you can often just call that person and just put them on speaker. That's all it takes. I often do that for my own mother in Florida when she is going for an eye exam, or when she's going to see a hematologist, or if she's going to see a surgeon. She calls me up, usually with a little bit of notice, and then she's like, here's my son. She's very quick to say my doctor. I tell her she doesn't need to do that. I'm sure that changes a little bit of the dynamic during the visit, but I'm there, and I'm able to tell from my mother's voice, and I'm able to say, do you understand everything? Please explain it to my mother again. And she leaves all her appointments after me at least being there by phone with such more ease and a lack of exasperation.
Something else that I remind patients of is that, especially those who are a little bit more tech savvy or just have access to things such as like MyChart, I remind them to use it. A lot of questions will come up after. MyCharts are electronic medical records,
apps.
yeah. But they can simply send a message, like a follow-up question, and because things come up, I just like threw a whole bunch of things at them, and maybe they didn't have a question at the time when I asked, but I always remind them, go home, talk to your family. If any of you guys have questions, please call or send me a message. Like, I'm more than happy to explain that to anybody, anybody in your family, and just to kind of set you at ease. And I think recognizing that and telling the patient that, it kind of opens that door, like, so they don't feel like, oh, well, I don't really want to bother them. I have some patients who have said that, and that's not the case. We want them to ask questions. That's what we're encouraging, so they can take hold of their health.
Good. And so we'll be doing some closing remarks here on some takeaways that you can take away starting tomorrow, starting tonight. Darren, we'll start with you. What do you think are 2 or 3 good points you can give to the public here and our followers on how to reduce confusion and frustration for a patient during a visit?
To feedback on the last speaker, yeah, definitely. Another great thing is become aware of your own health. Research it online and become aware of what that ailment is. That can be very motivating, and going into an appointment and asking those specific questions that our providers can answer for us, and that's very, very, very empowering. I think to be motivated enough to learn, even for your own self, what you're going through, and be able to explain that.
Okay.
And I appreciate the opportunity for being here.
Oh, no, Thank you, Darren. Dr. Pradhan, we'll start from the end down there. What will be your closing remarks?
So I want to advocate for a primary care provider or primary care physician. I think I stole their thunder. The reason is this healthcare system is very difficult to navigate, even for those of us who work within it. And so when you don't work here, it's very difficult to understand how the flow works, which questions are the right ones to ask. A primary care provider is somebody you see for your, regular preventative visits to keep yourself healthy, to get your immunizations and all of your screenings in place so that things can be caught early. It's also somebody you develop a relationship with and your go-to person when you get hurt or injured or you have medical questions. And it's the person you ask those private questions to that you aren't quite sure who to ask and you don't really want to Google it. So it's good to have that go-to person. And this person is also going to advocate for you and be your home base. So if you need to go to a specialist to get care, to get surgery, or have a procedure done, you have somebody who can follow up and say, what's the next step? If that didn't work, what's next? So I think that is one of the most important things I do in my job is just to advocate for my patients and follow up on things, answer questions for them if they don't understand what the specialists have told them. So thank you.
No, that's great. So I am in a specialty, and I specialize in cardiology and pulmonary hypertension specifically, and that can get really complicated, but being surrounded by primary care providers, we need them. And I don't think that some patients understand the importance of, follow-up care and just kind of your basic needs in between like your specialty visits. I tell patients all the time, if you have something going on, like reach out to your primary care physician. If they have questions, have them reach out to me. So that way we can be all of us can be on the same page and we're not changing things here and there and going back and forth. And I tell patients all the time, like, ask questions, just if there are no stupid questions, no dumb questions. Googling it can take you down a rabbit hole. I'd rather you just, reach out to your provider because that's going to give you a direct answer based off of your specific needs and treatment and whatnot. As we were saying earlier, getting a second opinion is you have every right to do that, and it doesn't. I think some patients are hesitant because they're like, well, I should trust this doctor because they're a doctor. But like I said, everyone's a little bit different. Maybe someone sees one thing and not the other. So that's why they're there. It's okay. You're not going to hurt feelings. It's just going to make us better providers when you ask questions and there's other people involved too. It's a team effort.
Erica?
My closing statement would be, yes, get yourself a primary care provider. That person is your advocate. Also, when you do have a primary care provider, go when you're not sick. Let's be proactive with our healthcare instead of reactive. So what I mean by that is make sure you are attending a preventive healthcare exam at least once a year, like Dr. Prada mentioned. But yes, don't wait until you're sick to go. Establish that rapport, establish that relationship, but get yourself a primary care provider.
Well, thank you everyone for joining us, and thank you again, Darren. Oh, that's an idea. And we plan to do more live discussions such as this that not only relate to particular certain specialties, but frustrations that patients have just navigating the healthcare system. I think the big takeaway here is try not to enter a clinic visit, ER visit, anything that's routine, preventative, urgent, or emergent. Try not to go alone. And, are there any questions there? Nope. All right. So that will be it for us tonight. If you want to learn a little bit more about Black Physicians of Utah, please continue to follow us on our Instagram. And also go to our website, bpou.org, or our YouTube channel for more health education content. Thank you, everyone.